This time next year, hopefully this virus will have ended. A vaccine will have been found, and around 100 Australians would have lost their lives. But in comparison, between now and this time next year, more than 10 times that figure of Australians will have lost their lives on our roads. Do the Premiers believe it was worth ruining our economy over COVID-19? Thank you.
Dan Andrews, I want to put this to you. All three of you have made these monumental decisions that are saving lives right now, but you've done so knowing that you are going to do damage, create hurt for lives down the track. How have you reached the decision that you've reached in that context?
Well, look, Hamish, these are not easy decisions to make. You've got to look at the facts, you've got to look at the evidence, you've got to look at what's happening in other parts of the world, and I'd simply say to you that no one has entered into the restrictions framework, the sort of rules that we've put in place lightly. We know that there's significant economic damage, but the thing about it is this: if this gets away from you, it's so infectious, it's so deadly, it moves so fast. It does also very significant economic damage if it runs wild. There are very big health and economic challenges throughout Europe, the United States, the United Kingdom. This is a health challenge first and foremost, and the best economics is to fix the health problem and then move to repair the inevitable damage, damage that saves lives, but yes, it does cost jobs. I think we're equal to that task. It'll take some time. I think National Cabinet is a fantastic forum, one of unity. It's completely unique. And I think that economic recovery, of course, states will do their own work, but the National Cabinet empowers all of us to do more, to do better. You've got to get the health response right first. That's what I think we've done. Not easy, really challenging decisions, but they have saved lives. And then hopefully we can get to a point very soon where we can start to focus on jobs, employment, investment, and repairing the very necessary damage that we made when we chose between a pandemic that overwhelms our health system where tens and tens of thousands of people die, or the response we've put in place, a response that is the envy of so many places right across the world, Hamish.
Annastacia Palaszczuk, obviously there's modelling now available from the University of Sydney which points to a significant increase in suicides over the coming, or suicide-related deaths over the coming years. I mean, you would have made these decisions knowing that there are adverse health outcomes no matter which way you go.
Oh, Hamish, absolutely. And I think there's not a day or a night that goes by that we're not thinking about the repercussions and what's happening to people. People's lives are being completely turned upside down. But the initial modelling we had was if we didn't flatten the curve, in Queensland there could have been 37,000 people that lost their lives. And thankfully that has not happened. But as Dan said, we know that at any time we could be susceptible for another outbreak. We could have a second wave. You only have to look at what's happening in other countries around the world. South Korea is a very clear example. You only have to look at what's happening in the US. Thank God we live in Australia. Thank God we've all worked together at the National Cabinet level. If that hadn't happened, I don't know where we would be. But we've worked collectively together. We've put people first. And of course, there is those extraordinary mental health issues that are happening, domestic violence. We know there's been an increase in presentations to our emergency departments, and we're dealing with that as a National Cabinet as well, and state by state. But we know now that we have to be focused on the economic recovery. We have to be focused on getting people back into work. There's dignity in work, and that's what my government is absolutely focused on, to make sure that we bring back some normality to people, because it's something that I never thought we'd have to go through in our lifetime, and I think there's been people struggling with it. Getting kids back to school. Today we had over 80% attendance. This is fantastic figures for our preps, our year 12s, our year 11s and our year 1s. We're at 80%. You know, it's coming back to some form of normality, and it's going to take everyone working together, and I just think that we live in Queensland. I'm very proud of the work Queenslanders have done, but I'm very thankful we live in Australia, and you only have to look around the world and see what could have been.
You mentioned a second wave, Annastacia Palaszczuk. The Chief Medical Officer, Brendan Murphy, said tonight that the possibility of that keeps him awake at night.
Of course it does. Of course it does. When we first declared this health emergency in Queensland at the end of January, I don't think I slept for 5 weeks. It weighs on your mind every night. Waking up in the morning, what are the numbers going to be? Where is there going to be an outbreak? What more can I do? The fact that people have had their lives turned upside down. I've got families where mums and dads have lost their jobs and they don't know what's going to happen when JobKeeper runs out. They don't know where they're going to get the food for their table. They don't know, what they're going to do to buy things in the future. So these are really complex questions and issues, and society is being turned around. But how about now we focus on what are the good things that's happened? Like, we've put together a care army. Neighbours are looking after neighbours. We had Erica, who fell over and broke her hip, and if it wasn't for the care army and the police, she wouldn't have survived. They came through her front door, they saved her, they took her to the hospital, and it was because we had put in place a care army, and Paul rang up and made that call to the police to look after Erica. So there is some good that's come out of this. There's a lot of bad, but I hope we can build a better society and think about workers as well, and having some secure work, more secure work into the future, and building our regions and making sure that people get employment as quickly as possible.